Here is how to compare not only you and your spouse's Part D drug plans, but see how you can get the estimated annual out-of-pocket cost for the future year, especially when you're shopping these plans during your open enrollment each and every year at the end, October 15th through December 17th. Or if you're brand new, it's based off your initial enrollment and when you enrolled into Medicare through Social Security with surrounding your Part B, as in boy, effective date. And so this couple right here, as you can clearly see, this one's a very low monthly premium for a standalone Part D drug plan because they wanted original Medicare as their primary payer for their health care services, but they wanted outpatient pharmacy coverage, and that is on page 7 on your Medicare and You Handbook for 2022 for your main path, or one of the main paths to get your medical services and supplies on your Medicare journey paid for by the federal government. All right, and so from here you can clearly see that one beneficiary's cost is higher than the others, and so that typically happens obviously when you have tier 3, tier 4, maybe even tier 5 medications that were being covered, especially if you were on group health insurance. They typically were covering those high cost medications, and this could be a sticker shock to a number of folks when you transition into Medicare and you want to make sure that you are looking into the outpatient drug coverage when you are trying to make a decision if you should transition into your Medicare benefits. And so this is for original Medicare because these are what's called standalone Part D drug plans, also known as PDPs. They are independent insurance companies and pharmacy benefit manager companies that negotiate drug pricing for Part D drug plans, and that is administered by Medicare. And so Medicare tracks enrollment into Part D drug plans, as well as they track Part D drug plan spending. That's why you hear about the donut hole if your medications are getting you out of the threshold of where they're no longer being able to help you cover as much cost initially on the initial phase, but that's a whole nother conversation. So if you want to look that up on YouTube, there's plenty of videos on that. So just note that for this example, we're looking up a specific medication that's making this annual cost of this beneficiary go higher than their spouse's. And so a lot of times you'll look up the medication. This happens to be an inhaler, and what's the cash price for it. That's kind of a good tip for you guys out there looking at certain medications. Well, if you can pay cash price for it, a fairly low amount, as opposed to using your Part D drug plan, that's actually a tactic that some beneficiaries use because they don't want to get their in the donut hole as quickly when they're using their Part D drug plan, if that makes sense. So so this person is trying to use an inhaler called Arnuity. Hopefully I'm pronouncing it correctly. And they're doing a lot of trying to find out if there's a generic. There's no generic alternative. You can also talk to your doctor or your pharmacist too to see if there are alternative options, and then from there you can actually call the member number of the actual drug plan that you either are currently on, or the non-member number of the drug plan that you want to look into because of the actual monthly premium or the cost sharing is the lowest. So when you're getting your analyzation on Medicare.gov, it's very important for you to have all the frequency, dosages, and refill amounts accurately inputted into the actual Medicare.gov drug plan tool finder, and that way you'll get most accurate but estimated annual drug costs and premiums for you or your spouse or someone that you're looking up Part D drug plans for. So after you kind of looked at the cash price and saying it's and seeing if it's like if it's doable for this particular inhaler or any medications that's close to it, it looks like that the cash price is not a good way to go. So here at MedicareSavings.us, we actually do this as a free service for those folks that are on original Medicare and that are our clients that have Medicare supplement plans. That way we can service you guys further as a free service to you by not only helping you with your Medicare supplement plan but also with your Part D drug plan. So from there we look at the actual formularies available, the BPM manager companies, the Part D drug plan companies available in your area. And it's all specific to your area, and that's why Medicare.gov is the only place where you can officially see all the drug plans in your area. But what we do is actually not only look at that, but we do a little bit more research for you to see if that particular drug, let's say it's a tier 3 inhaler drug just like this, if there's other plans available to you, because we don't want to try to pressure you into any specific company. We're independent. We're looking for your best interest as a brand that has been helping retirees save their hard-earned retirement since 2016. So as you can see, Humana has 10 plans. They have a standalone Part D drug plan. There is a quantity limit of 10, but if you're on group health insurance, look how much it covers. It lowers the tier to 2, and then look, has a quantity limit even higher, 30. So that's why if you're on group health insurance, you want to discern whether you should transition into Medicare or not, or wait until retirement. You might have some more savings to account for some of your outpatient drug coverage that you might need in retirement, or cost you might need in retirement to spend on your drugs. So from here, we go back to Medicare.gov, and then we just take a look. Okay, so Humana is the second option, but looks like SilverScript Smart RX is the first option due to the lower monthly premium as well as the lower estimated annual drug cost. And so if this is doable for you and this is the best option for you, you would go to, especially if it's within your enrollment period, you would click enroll, and then literally you would click join the plan, and you need some basic stuff like your Medicare number and the Medicare Part A and B effective dates, and then from there you just go step by step by joining the plan. And you would say either I'm new to Medicare. It's very simple, very easy. Now what this does is starts the application process for you, and it gets you in contact with the actual Part D drug plan company. And so you join and just hit next. But obviously if you're new to Medicare and you're losing group health and anything like that, you just go through these step by step. And you can always call 1-800-MEDICARE, and they have a free chat. If you're on your MyMedicare.gov account, they have a free chat support as well. So just note that it's very simple, very easy to do it online nowadays, especially to save time and to make sure that you have the most accurate information in front of you because you're looking at it yourself. Okay, so from here, guys, if you have any questions about specific tier 3, tier 4 medications, please comment in the videos, so that way more folks can understand what tier 3, tier 4, or higher tier medications that are very expensive for the folks that are transitioning or new into Medicare, and for the folks that are already on Medicare and just don't know, maybe the ins and outs or the tips to help save on their Part D medications on their Medicare journey. So appreciate you guys sticking around. Please let me know if this video was helpful, and if you have any questions or comments, please feel free to reach out to us. at medicaresavings.us. Take care and God bless.